healthcare settings play a very important role in placemaking and regeneration, because ultimately they are places that people use every single day. And the way that the sort of direction of travel with the government and their place on the importance of community within healthcare, I think is going to shape how things move in the future. We've been talking today about the public-private partnerships and the community hubs that are being developed, and I think they are going to be really key moving forwards to seeing how placemaking presents itself in the future.
Well, they are ultimately really good anchors for regeneration schemes where they can bring health hubs into the community. They're great job opportunities and they're really good for research and innovation in the regions. Whenever you have some form of regeneration where you've got an NHS hub within the community, it means that people have access to healthcare, they can be diagnosed properly. And it also means that people have got more job opportunities, and then actually what happens on the coalface in those practices can be fed back for research and innovation within the NHS.
I think NHS estate can play an increasingly important role in placemaking regeneration. I think the reality is that NHS trusts have both bigger land in terms of how they could play a part in the wider regeneration, but also clearly an interest in terms of making sure that we are improving the overall health outcomes of a community. So putting those two things together makes sense that an NHS trust could look at its land and see how it could support the overall regeneration and health outcomes of a community. It's in the NHS's interest. And we've got the land to help make that happen.
Well, from a planning perspective, I think the past mistakes we can learn from over the next decade is that planning needs to be better at not preventing development. And that is, on the wider basis of development as a whole, but from a healthcare perspective. Health needs to move at pace in order to deliver outcomes for patients, in order to be able to allow the market to deliver cost certainty and to enable people to understand what that pipeline is, whether that be from a construction perspective or from a staffing perspective or a training perspective. And I think unless planning keeps pace with that and is able to adapt to putting things in place to allow the construction industry in particular to rely on its outcomes, I think it will continue to be more of a struggle than perhaps it needs to be.
Capacity is a massive issue, not just from ourselves, but from the supply chain that feeds into ourselves. Actually, only this morning we were having a really detailed conversation around what the impact of all the large programmes of work are going to have on the Northwest. And actually, if you think about heat mapping the overall volume of work, that our Northwest construction industry is around about 20 billion a year, and of that, we're probably going to see that go to 25 to 30 billion as a result of all the other work that's going to be happening at the same time, which is clearly going to mean that we're going to have to align ourselves early with our supply chain, the fact of the amount of roofing and things that are going to be needed on these buildings, and actually aligning ourselves with manufacturers now ready for the next 5 years, because they were just not going to get the material.
I think it was a really kind of well-rounded sort of discussion. It was great to hear the variety of views from the different professions and from the different kind of backgrounds. But I think everybody is passionate and clearly is very enthusiastic about improving healthcare estates in the UK in all the places that they're kind of responsible for. And I think that is something that I'm sort of, encouraged by. And I'm sure that is only a sort of the tip of the iceberg of the industry that really will give you a flavour for how we're sort of coping and dealing with the challenges of delivering brilliant healthcare buildings.
My takeaway from today is quite clear. It's all about confidence in the market, confidence that the programme's now going to be delivered. It's good to see that that Leighton and North Manchester are in Wave 1 and that they're actually going to be delivered. They've now got NHP people aligned to them or allocated to them, which means that there's going to be traction now. It allows us to get re-engaged with the supply chain market again, so that they've got confidence that they're going to happen, because quite clearly the fact that that national kind of decision making has been so stop-start has meant confidence in the delivery has been impacted massively. So early contractor involvement is key, especially where we've already outlined the fact that there's risks with the supply chain and demand in the supply chain. And then also the integration that we can bring in terms of optioneering and the right design solutions.